You are watching the DocTalk show.
Welcome back. We are discussing heart diseases that affect adults, and now we want to understand more about what causes these heart diseases. We understood in children tend to be born with these diseases. How about in adults? Could it be the same picture as in children? So I will start with Dr. Emmy. Um, could you help us understand more about what could cause these heart diseases in adults?
Heart diseases now account for 1 out of 10. 1 out of 10 of all heart diseases in Uganda is now caused by heart diseases, so it's definitely a big problem. It used to be much smaller than that. And so when you look at birth defects, heart diseases due to birth defects, those account for 1 out of 100. So 1 out of 100 children born will have a birth defect due to heart disease, yes. And then rheumatic heart disease is at about 3 out of 100. High blood pressure, acquired heart disease or acquired disease of the vessels is a big problem. The current statistics we have from the Uganda Bureau of Statistics puts it at 1 out of every 4 adults. As you go further, coronary artery disease or disease of the blood vessels of the heart accounts for 1 in every 200. But that is something that is rapidly changing.
So tackling now these factors that cause heart disease, you mentioned high blood pressure is 1 in 4 people have high blood pressure,
yes.
And the likelihood is very high they'll get heart disease as a result. So it makes high blood pressure or hypertension one of the most common causes of heart disease. Could there be any other causes you've encountered?
It's a lifestyle disease. Most people will have had high blood pressure running in their family, your grandparents or your great-great-grandparents. But the things you do with your life kind of determine when and how severe this blood pressure develops. So if someone, eats a lot of raw salt in their diet, they eat a lot of processed food, so most of these foods have added salt. This salt then draws and holds this water in your body, and your blood pressure starts to go up.
Alcohol is a very, very big toxic agent, and as far as our bodies are concerned. Yes, somebody may say, but yes, we use alcohol in the church, we need some alcohol. Yes, we take wine, but we take wine in very small, not even moderate, small amounts. When we go to church, it's blessed and we partake of it and no problem. But then when we go out and we take alcohol in excess, it is a problem. So excessive use of alcohol is a risk factor for heart disease. It's toxic to our hearts, it damages our heart muscle.
Okay.
Two is the use of tobacco products. I'm happy that the government eventually put forward a law which is regulating the use of tobacco. But tobacco per se has about 400 toxins. Tobacco smoke has
That
about
is from the
400
yes.
toxins. And all these advertisements that we get which tell you this is light, this is moderate, all that is just simple advertisement. The bottom line is it has a lot, the tar that is within the smoke has over 400 toxins. And these toxins predispose to a number of diseases, including atherosclerosis, which causes coronary artery disease, which we have mentioned before. But it can also give you what we call a tobacco heart, which is a very, very weakened heart whose muscles can't work well because of the toxic effects.
Because the
of
deposits
tobacco.
of the toxins go into the heart.
So it's very important that we desist from smoking or even using tobacco products, including shisha, which
And it's a very
has
common
hit the
phenomenon
market
these days.
and has become, some kind of swag or style. But I'm happy that also the local governments in the different parts of the countries are addressing the issue of shisha.
Okay.
Then technology. Whereas we want this technology to help us improve on our life, make our life easier and work easier, technology has made us lazy. And so technology is making us more and more sedentary. We do not exercise adequately. So if you do not exercise adequately, you are likely to accumulate excess energy. And that is all converted into fat. And that fat has two problems. One, we get a lot of atherosclerosis developing and deposited into your blood vessels. That blocks your blood vessels. When it blocks the blood vessels of the vital organs, like the heart, the brain, the kidneys, then we get into problems. When it affects the heart, your heart muscle may die off. When it affects the brain, you may get a stroke, which is like a clot, we call it a thrombotic stroke. All those are blood vessel diseases which are counted amongst heart diseases.
And they come because of fat deposits.
Now, when
within
it
the blood
affects
vessels.
the kidneys, then now you go into failure, the kidneys fail, and they in turn affect the heart.
So it's
Okay.
kind of an interrelated system. One thing
Exactly.
affects the other and affects so many other.
But on the other hand, the fat is going to increase your body mass. And when your body mass increases, then it means the work that the heart has to pump blood to the whole body increases. So there's a new body now you have.
A bigger body.
A bigger
so
body.
The heart has to pump harder.
The pressures are going to rise, and you're likely to have high blood
So
pressure.
that is the direct effect of weight.
Yes.
In causing
In
the
addition
heart
to the
disease.
excess salt which Dr. Kello has talked about, you are predisposing yourself to very high blood pressures.
Dr. Kila, how about the role of infections? This I know you're a specialist in the field of rheumatic heart disease. What role does infection have in causing heart disease?
Majority of the young adults or the children or adolescents that have heart disease have this kind of disease, and it's better prevented. Usually this bacteria spreads where people are overcrowded, because it then is transmitted from one person to another very easily. So treatment of sore throat is important, but also if you are a policymaker at a school or in places where there are many children, it's important to think about the spacing and avoid crowding, like in dormitories and things like that.
And I think also in addition, conditions such as diabetes and those other, what they call the comorbidities, they are diseases of other organs that directly impact on the heart. For example, like kidney disease, or in the case of diabetes, too much sugar in the blood causing damage to the blood vessels, so it causes initiates the process of the atherosclerosis.
That fat
those
deposit that
depositions of the
eventually
substances.
narrows your blood vessels, and so not enough blood is reaching your important body organs. So it's important. Actually, we say that when you have high blood pressure, most people with high blood pressure also have diabetes, because they're both diseases of together. Yes, the diabetes causes more damage to the body than the high blood pressure. And usually we say if you treat the diabetes, if you manage to control the diabetes, and controlling it involves reducing your weight, handling what you eat, and all that, then your outcome is much better, even for the high blood pressure. So it's a key thing to target. Those are the diseases that are not heart disease, but have an effect on the heart.
Okay, so I think we shall come back more into discussing the prevention, because like we've understood, most of these diseases come as a result of lifestyle. So emphasis has to be put on prevention. So after the break, we shall understand more about how to prevent ourselves from getting these heart diseases and what has been the role of the government in fighting heart diseases within the country. Don't go away.
You are watching the DocTalk Show.